Hi, we're here with Dr. Donald R. Nunn of the Beauty of Knowledge next to St. Joe's Hospital in Atlanta. Dr. Nunn, I have some questions about rhinoplasties. What is a rhinoplasty?
A rhinoplasty is a procedure on the nose. It usually is a cosmetic procedure to improve the appearance of the external nose itself. It's usually combined with other procedures such as septoplasty or turbinate surgeries if the patient has a breathing problem.
So a rhinoplasty by itself is not going to help the breathing?
No, the rhinoplasty in general covers the external nose. The internal part of the nose is a separate procedure. Usually insurance covers internal reconstruction, which may improve breathing, but they will not cover a rhinoplasty, which is a cosmetic procedure only.
What is the difference between an open and a closed rhinoplasty, and which one's the best?
Well, different surgeons like different procedures. Probably most rhinoplasties in the United States at this point in time are done open because it allows you better access to see the nose itself. With an open rhinoplasty, you make a small incision in the columella underneath the nose and lift the skin of the nose up, and you're able to better visualize the cartilages of the nose and to adjust those structures in a direct manner. With a closed rhinoplasty, it's all done through the nose itself, and in some surgeons' hands it's a very good procedure, but in my hands I prefer the open technique since it allows me better visualization and control of the structures that I'm correcting.
Okay. If someone has a bulbous tip on the nose, can you fix that?
Yes, that's a very common procedure with rhinoplasty to narrow the nasal tip. A lot of the bulbousness depends on the patient's skin type though. Someone who has thick skin, it's hard to make their nose very tiny because the skin itself will only contract so much. And you can't safely thin out the skin because you can compromise the blood supply to the skin. So in most cases though, you can even improve a very thick skinned person's nose, but the thinner the skin, the more control you have over the final appearance of the nose.
Okay, so if I had really thin nasal skin, does that keep me from having a good cosmetic result?
No, actually patients with thin skin probably have a better cosmetic result because the underlying cartilage structures are better visualized through the thin skin. Now if someone has very, very thin skin, then sometimes you may need to thicken that up a little bit. Say they've had multiple rhinoplasties and their skin has thinned out, they may require some fascia from the temporal region of the scalp to overlay the underlying cartilages to prevent any subtle irregularities could be seen through the very thin skin.
Are you ever too old for a rhinoplasty?
No, I mean, you can do a rhinoplasty at any age. Older patients usually have different needs than a younger patient. Usually their nose droops as we age, just like other tissues in the body. Gravity tends to pull it down, so a lot of times shortening the nose in an older patient will rejuvenate the entire face and give them more of a youthful look. So there's no timelines on a rhinoplasty as far as age is concerned. Sometimes we don't like to do a rhinoplasty in a very, very young patient because they haven't finished growing, but we can do rhinoplasties in teenagers as well as in patients that are elderly.
And what age do you start doing a rhinoplasty?
Again, it depends on the patient, whether they're mature enough mentally to handle the surgery, but also whether their facial growth has completed. That's the earliest that we would do a rhinoplasty. So it varies from patient to patient.
Okay. Is a rhinoplasty an outpatient procedure?
Yes, it is. Very rarely would we ever keep a patient overnight unless they were having other procedures along with the rhinoplasty, and those procedures would cause the patient to require overnight stay. The patient is done outpatient and discharged that same day, and they have bandages on the external nose and sometimes on the internal nose if we're doing some septoplasty or turbinate work, but all that comes off at a week.
Okay. What is the downtime?
Generally, I tell patients about a week. Some patients can go back to work even with the splints on the nose if they are not too self-conscious about their appearance. But, there's no real downtime other than most patients don't want to be seen in public with a splint on the nose. And like I said, that all comes out in 1 week, and most patients generally take a week off before they go back to work. The results take longer than that. There's still swelling when the splints come off. It takes several weeks to go down, but most people feel pretty good about themselves in a couple of weeks.
If someone wanted a rhinoplasty revision, how long should they wait to have the procedure done again?
Like I said, there's swelling after rhinoplasty. Most of that's gone within a month, probably 85%. There's still probably 15 to 20% that takes up to a year, but it's very slow in resolving. So we don't recommend any kind of revision rhinoplasty for at least 1 year after their initial surgery. By that time, things have settled down and you have a better idea of what needs to be corrected and how much it needs to be corrected. Otherwise, if you do surgery too soon after the initial rhinoplasty, you may still have swelling and overshoot or undershoot your final result.
Okay, well, thank you very much for your time. Again, you can see Dr. Nunn at the Beauty of Knowledge and call his office at 404-255-2975 to schedule your consult.
Thank you.